A measles outbreak in New Brunswick is spreading. There are now 44 confirmed cases in the outbreak that began last month with a single travel-related case. The health department says all the cases are in Fredericton and the Upper St. John River Valley. Most of the people infected are under 19 and all of them are unvaccinated. To talk more about the measles outbreak in New Brunswick, let's bring in our medical specialist, Dr. Marla Shapiro, to talk about measles and why this might be happening and also to get some advice. Dr. Shapiro, thank you as always for joining us.
Pleasure.
What's going on? This is concerning.
It's
What's
really
happening?
concerning. You know, what we're seeing is the lack of immunization. So it started with one case that traveled abroad, brought it home, and now it's spreading like wildfire, where every case that has subsequently developed can be tracked back to this one imported case, typically happening in young adults under the age of 19. And it really speaks to the lack of immunization. This is a vaccine-preventable disease, and it's a serious one.
And we're at, I think, 100 cases across the country. People will say, well, that doesn't seem like that much, but it's the highest we've seen in a while.
The highest, and it is so infectious. This is one of the most infectious viruses that we have. It's very effective at transmitting. It stays active on surfaces. It's airborne, easy to get. But people don't recognize sometimes the symptoms associated with this. The fever, the cough, the runny nose, red watery eyes seem non-specific, but then eventually you get these classic white spots in the mouth called Koplik spots, then a blotchy rash, usually starts on the face, spreads everywhere, a sore throat, muscle pain, sensitivity to light. It's not the disease itself. You're infectious for 4 days before you have the disease, and then you're infectious at least for 4 days more. So, you know, you've got that period of time where you're walking around not even knowing that you're transmitting the disease efficiently, but you are. But it's how serious this disease is. This is just not a viral illness that comes and goes for a lot of people. And it speaks to those who are unvaccinated who are most at risk, usually children. And if you look at what happens, it's not necessarily a pretty story. It's not necessarily self-limited.
What are some of the concerns for more serious side effects?
So lots of serious side effects associated with this. First of all, if you're unvaccinated and you get the disease, particularly younger people, or if you have an impaired immune system, you're looking at a hospitalization rate, and that hospitalization rate can be as high as 1 in 5. You're looking at 1 out of every 20 can get pneumonia. That's one of the most common causes of death, a measles pneumonia. Encephalitis, that's a brain inflammation caused by the measles. 1 in 1,000 can get that, and if you get that, you can end up with long-term sequelae like convulsions, neurological disorders, impaired neurological function. 1 to 3 out of every 1,000 children can die from respiratory or these neurological complications that we've just talked about. And if you're pregnant and you get measles, that can lead to premature birth or a low birth weight. It's not such a benign disease.
And just one, before we go, we're almost out of time, but there's also a long-lasting concern, the impact it can have.
So this virus is very unique in that it has something called immune amnesia. When it infects you and it affects your lymph cells, which is how we get our lymphs involved in our fighter cells, it removes the amnesia, in a sense, the antibody response of previous infections that you have. You lose that historical memory, so it leaves you at greater risk for infections that may be coming your way in the future, and that impaired amnesia can last for the longest period of time. If you're born before 1970, you're probably good to go. If you're born after 1970, make sure that you've had 2 doses. If you're traveling and you're 6 months to 1 year, you can immunize your baby, but it doesn't count. They'll still need 2 shots after they are a year old, because that's when we give them. We give them typically at a year, and then a second dose later on. Adults, you know, born in 1970 or later, make sure you've had 2 shots. And if you've born before 1970 and you're traveling and you're, you know, not sure if you did have measles or don't, have at least 1 shot. But you really need to know your vaccine history and not get complacent about this. This is a significant illness.
Okay. Dr. Marla, thank you as always. Dr. Marla Shapiro is our CTV medical specialist.